Hi guys, Namaste. My name is Dr. Sandhya Ramanathan and I'm a GP in Auckland, New Zealand. Today And this is another very good way and a good exercise to do. And I would suggest that you would do these exercises seated, and you would do these several times a day and recheck your oxygen saturations. Now, in addition to these exercises, the other extremely important thing is your posture. Now, to demonstrate that, I've got my beautiful doll Rani and a little cushion. Now, as I explained to you, the lungs are mainly, most of the airways are mainly situated at the back. So if we are to lie down for prolonged periods of time, what's going to happen is those airways, which are mainly located at the back, are going to get squashed and more likely to collapse. So when you are sick, it is very important, and it's good to start doing this when you're feeling well, is to sleep on your front. Now, you might think that that's very uncomfortable, and if you have the pillow under your head this way, it is going to be uncomfortable. But if you rotate the pillow long ways and you sleep with it under your chest, as you can see, Rani is able to fully expand her chest at the back. And I've had another case where a lady in her 70s was having saturations at 92, and she couldn't have access to any hospital beds, but just by sleeping at night on her tummy, she was able to bring her saturations back up to a safe level. So this is a very, very important thing. If you are sick, you are not meant to spend prolonged time lying on your back, and it's preferable to lie on your front, which is what they call a prone position, and it's what they're using in hospitals and also in ventilating these patients. It is also very important to get medical advice, even if it's virtual, at the onset of your symptoms, because I know in some countries they have protocols for simple antibiotics which they can prescribe, which are most effective if they've taken early. And most of these simple can be taken by most people even if they have underlying conditions. One of them is azithromycin, 500 milligrams once a day for 5 days, and some countries are adding in hydroxychloroquine as long as the patient's ECG is normal and they have no other medical problems. But again, that would only be done with somebody medical overseeing it. But the important thing is to stay calm. And if you do these three things, I'll just reiterate, they were boosting and priming your immune system. Number 2 was reduction in viral load. And number 3 was breathing exercises and maintaining a close eye on your saturations every day, at least for the first 14 days of the illness, and making sure that it stayed above between 95 and 100. Then you can be very happy that you will be fine and you will make a full recovery. If you need, what I will do is I will, that is quite a lot of information I've covered, but I will keep a brief description in the description box below. And just remember that there will be light at the end of this tunnel, that if you use the knowledge that we have gained over the last 6 months and you practice these things, you have a very good chance of making a full recovery and you will not need hospital level care. So please take all the adequate precautions to not get infected in the first place, and please stay healthy and stay safe. Thank you.